we're trying to look at kind of all around for prevention care rather than just that one yearly visit kind of thing. And I know that there will be questions coming in, so hopefully I'll be able to see that chat window without a problem. So I mentioned wanting to talk about different levels of prevention, and that's where this first slide comes in. And I'm a doctor, so there's a lot of verbiage. I'm very sorry about that. But please read it along as I talk. First, there's kind of three broad categories that at least the CDC kind of talks about. It can become more, but the idea is that there are primary, secondary, and tertiary prevention. Each of these kind of have a unique role in terms of where they fit into individuals and the community at large. I think when people think about preventing disease, we're generally thinking about primary prevention, where we're trying to eliminate the onset of illness. And that can be within individuals themselves, or as the community I mentioned. I think a great example of community interventions has to do with things like passing the Pollution Act, environmental protections, and particularly like eliminating lead from our community, particularly from gas, paint, and those items. Additionally, we think about, talking about healthy nutrition, and that does vary between all people. So, if you're diabetic, it's different. If you're, allergic to something, it's different. And then encouraging people to get vaccinations for our common diseases so that we can protect ourselves and also imbue that protection onto others. Another type of prevention that we will generally do at most visits that's very important is that not all diseases show symptoms for people. So we want to look for those items and catch them at the earliest stages possible, preferably before they're creating an impact on people's lives. A good example, kind of going with the lead comment, is that sometimes if people are living in older homes or in communities where we have found through research that the lead levels are high, we might consider doing blood screening for that. In terms of looking at blood pressure, that's a great one because people generally don't have symptoms even if their blood pressure is high. So we generally like to have those commonly taken. In terms of kind of the tertiary, that's maybe not as much prevention to most people, but I certainly think it fits into the context of prevention. Minimizing the progression of disease, making sure that any type of symptoms that people are having are minimized as much as possible to improve their outlook and their physical well-being. In terms of our kind of going with the examples from before, if we do believe that people have high lead levels in their blood, we'll have to obviously consider treatment for that, or considering medications to manage blood pressure properly, or giving antibiotics or other types of therapies to eliminate diseases or prevent their progression. So there's different levels in that. In terms of how that fits into our broader community, I do believe that we probably fit in more so into the primary and secondary prevention, but all of these are really inclusive. And all of these are things that I consider when I see my patients for general preventative care, whether that be a dedicated wellness visit or a checkup, or even just checking their blood pressure every day, or every visit, I should say. So I'll have you turn to the next slide if you can. I will as well. And here we are kind of getting into the idea of these nuanced visits. And I think everyone's fairly aware of the annual visit, the wellness visit, where we come in once a year to talk about our general health status, to make sure there's no new problems, to make sure that any previous problems are managed up to date and appropriate as our body changes with time. I think that screenings are something that a lot of people are very familiar with, but may not be aware that we consider these things at multiple visits, not just these annual visits. I've talked about blood pressure checks multiple times, and I certainly do that at every visit that I have with my patients to ensure that they're accurate and well controlled. I think in terms of other methods, we want to consider other screenings in terms of catching cancers before they happen with pap smears or mammograms or colon cancer screenings. We want to talk with people about ways to minimize their potential for coming down with viral infections, either influenza or COVID or the common cold, as we might call it, all sorts of things. And in terms of checkups, I think that might be more tailored to the doctor and to the patient at hand. I think that there's a wide range of need for checkups, and I think that they're severely underutilized. I think that a lot of people don't necessarily know that I kind of want to keep tabs on a lot of stuff with people. So sometimes if someone comes in for a wellness visit and I ask about how everything's going at home, and they mention that, you know, it's a little bit stressful because work's been tough, or, you know, my kid's been sick or something, you know, I think it's a great idea to have that person come back in at a later date, you know, to talk about that and make sure that that's not becoming a problem. Or if it is, we can kind of talk about ways to intervene on that, be it lifestyle changes or medications or whatever we need to consider. I use mental health as a big one because that is something that we should be very aware of in the Northwest with our amazing winters. But also mental health needs to be continued talked about more, both in the primary care setting and in our community. So there are a bunch of other things I could talk about, but I wanted to take a moment to focus on that. I could talk for hours about this, but I think it's probably better if we maybe open this up to questions or kind of go from there. So let me see if I get that chat box open.
Anyone can also pipe in if you have any questions as well.
Yeah, absolutely.
I am trying to get your slides up right, but for some reason they're not wanting to play nice this morning.
Oh no, that's a bummer.
Are you just seeing a Q&A when you look up there, up on the screen right now, Dr. Jordan?
Yes.
Well, I'm looking at my PowerPoint slides, and in front of it, since I'm on my iPad, I have a chat box.
Okay.
So I've got a question for you. If what can we end up doing for preventative care, just general health and prevention of, say, COVID-19? What can we do to prevent that kind of stuff in our daily life? Especially, you know, exercise being probably a key factor in that, and with the smoke and air quality being so terrible. What other things can we do?
Yeah, well, I mean, now we're looking at obviously a bad pandemic and then great environmental smoke, as you're talking about. So there's a couple of things playing a role in that. I think, let me break that down into little pieces quickly. I think we need to consider COVID in terms of how it's spread in the same way we think about influenza, and the same thing we think about other viral infections. Unfortunately, it's much more contagious than that, but the concepts are similar. The major one that I think everyone's quite aware of is the importance of masks, because it is spread through respiratory droplets that we can't really control, and masks do minimize the spread of that. So that's obviously mandatory in the state, so I won't focus on it too much. But I think more importantly, something that I think we're probably all guilty of, myself included, is that we don't clean our surfaces enough. You know, my colleagues, when they come in once a day, they clean the keyboards, they clean the mice, they clean the, you know, light switches. So I think we should be doing that at home as well, since when we're at home, we're touching our face and our eyes and all those things that carry those respiratory droplets. In terms of, you know, minimizing our risk factors for COVID, you know, you mentioned exercise and potentially, maybe you meant that in a way of weight management as well. You know, exercise is definitely going to be limited due to our lack of access to gyms. But I do think that there's a lot of different ways to perform exercise at home in terms of a small amount of space. I have myself lived in very small quarters most of my life and learned how to do kind of those aerobic type exercises were more calisthenic based, rather than running and those types of things. It's a bit different, takes a lot of adjustment, but certainly something that I think we should all start getting used to a little bit with that. In terms of, you know, the running and things particularly, that's kind of why I was focusing on the calisthenics, because of the great smoke right now. Thankfully, that shouldn't be a long-term problem. I mean, we should be having it cleared out. It might still linger with some issues for the next couple of weeks, but that shouldn't be a long-term issue moving forward for several months, unlike COVID, which we don't really know quite yet where that's going to be going. I hope I tried to pick that question apart since there are multiple pieces. Before I move on, do you want to follow up with that briefly?
Yeah, I do. And that was a very broad question, so thank you. You know, one of the things I was curious about also was, you know, is there anything that we can end up doing, you know, maybe from a dietary standpoint, supplementation through micronutrients or something like that that can you know, be beneficial in the, you know, in immune health and prevention of infection? of the infection.
Definitely. Obviously, COVID is such a new instance that we are still very much so in the early processes. And so I can't really give you a strong recommendation with any quality evidence about some specific nutritional supplement. I do think, though, that taking a multivitamin once a day that has kind of the full spectrum of fat and water-soluble vitamins is key. I think a bigger part about nutrition would more be about the amount of consumption, because that is a large problem in America, focusing on portion sizes and the quantity in which we eat, so that we're not running into problems of, that COVID weight gain, those kinds of things. In terms of things that I think are quality for health, other than those types of aspects, I think we all probably need to be considering some element of vitamin D discussion with your doctor, since we do live in the Northwest and a lot of us are low on that. Kind of, focusing on getting a well-balanced diet, because in America, we have the luxury of having an amazing amount of resources within our food that numerous countries don't have. And so most people do not require a very specific nutritional substance. So yeah, I hope I answered that. Thank you very much. I got 2 questions, so I do want to move on, if that's okay with you.
Yes, sir. Thank you.
Cool, great. So I think both of the questions here are great, number 1. Number 2, I think that they are kind of going to play off each other a little bit. So I'll kind of read off the question first and then second. So when it comes to immunizations for kids, how do I get back on a timeline for them, or for me, if I have not gotten them with my doctor in a while? The second one is, what are your thoughts about the flu shot this year? So let's talk about the first one as more of a general schedule of immunizations. The medical community has had multiple contingencies in place for people who are not necessarily on track for their vaccinations. So that type of possible issue, I guess, is not new to us necessarily. And there are plans for very specific vaccines and the particular patient age and those types of things about how we catch up. So if you, for instance, have an infant and the doctors were kind of recommending not to come in for several months or whatnot, we have a plan in place to get those vaccinations up to date, get your child preventatively healthy. And those are things that have been studied by large organizations such as the CDC and have quality recommendations across multiple organizations. And that doesn't just apply to kids, that applies to other vaccines. One that's recommended a lot is the shingles vaccine. And so a lot of people probably, who need that may not have gotten it for a period of time due to COVID. We certainly have plans for getting those types of things with people. So I certainly recommend reaching out to your doctor's office and talking about that, because we certainly have at least a plan or an answer for you. In terms of the flu immunization, I cannot give a bigger thumbs up. So that's the short version. The long version is that while we are not necessarily certain about the interplay of COVID and influenza this year, I think that it would be maybe not the best practice to consider withholding a flu vaccine for someone, because you're concerned about how that's going to go, or you're concerned that maybe if we have COVID, we're not going to have influenza. I think the flu vaccines are very important for preventing the spread of a very contagious and very serious illness that also harms a lot of people per year, hundreds of thousands, and numerous deaths as well. So I cannot spend enough time talking about how important the flu vaccine is for people this year. Does anybody want me to maybe to address any thoughts about the influenza vaccine, or any more details about how it's recommended for timing or anything like that this year? Cool. Well, I'm at least going to talk about the timing then, since I mentioned that. So number 1, now is the best time. I certainly think that we want to get the bulk of our population with the flu vaccine done by the end of October. The goal for that is because we are hoping that we can get a bulk of the population immune to that, at least for the 6 months that it's valid, which can help prevent it spreading among individual members, because there are certain people who cannot get that vaccination. So now is the greatest time, but if for some reason you're sick right now or something else and you can't get it for now or October, we certainly recommend getting it after that, up until at least I would say February or March at this point, since that's generally how long our flu season has gone in years past, although it could vary. Still an ongoing thing, clearly. Yeah. Anything else that I can answer questions about regarding preventative care, or just any other questions that people have?
I have a question for you regarding exercise. You had mentioned that you're doing calisthenics at home and such, which I completely understand. I belong to LA Fitness, and when COVID hit, they happily froze our memberships and didn't charge us anything. And so I've been waiting to see what transpires after that. And I was frankly shocked because I went there probably 2 or 3 weeks ago just to check in, not to attend the gym, but just to get a check because it was open. And they were very friendly, and they said, "Oh, it's all great. We check your temperature when you come in, and you have to wear a mask in between using equipment. But when you're using the equipment, you can take the mask off." And I thought, well, that is the most backwards thing I've ever heard. Like, I know you're not in the governor's office, but it just seems so counterintuitive to me that a gym would allow you to go in there and when you're exerting yourself, not wear a mask. So I guess it's sort of a two-part question. You know, I've taken to riding my bike, which has been great, but that's not going to last forever as we get into the fall. So what are your thoughts on, is it safe to go to a gym under any protocol? I guess might be the way to phrase the question.
Yeah, that is definitely a good question, and one that I wish there was an easy answer for. I will do my best to do that. Number one, we're looking at this disease in context of not just medicine, but also our social life and our business life. And, you know, it's altered a lot of things. I hate to say one way or the other on this one, either meaning yes or no, because those have really deep implications for how everything else goes. I think that I don't really know much about that gym that you're talking about, so I don't know how big it is or anything of that nature. I don't know what the spacing of the machines are and such. I think that any such decision about going back to a gym has to really be considered strongly. It shouldn't be taken as a light decision to get back to that type of environment right away. You know, it might be one of those things where you talk to your doctor in such a way which, like, you take pictures of the location if possible and kind of maybe show some spacing of it. You know, you mentioned the mask policy, which is something certainly I think would be worth discussing with your physician or medical professional. And I also think as we learn more about this as time, we have to be open to readjusting our thoughts on this. So my medical opinion now would be different than in 3 months, is how I'm basically suggesting that. And so I know I'm kind of skirting that question, and that's really the reason why I'm skirting that question, is because I don't want to give you an impression of something that's going to be lasting and permanent, since that's not the case at this point. As a caveat to that too, I am always a little bit concerned about, you know, the fact that most viral illnesses do tend to spread more in the winter, and there's a lot of research spent into that. So I am not giving a definite answer on it, but it does seem to be just that the close quarters being indoors with our amazing weather in the winter, as you mentioned with your bike riding, is certainly a risk factor that has to be considered at least. But I would be pretty tentative about rejoining at this point.
Thank you. That's helpful. My physician is actually a member too, and I'm going to see him in a month. So my first question is, are you going back to LA Fitness?
Yeah, totally a good question. And yeah, in a month, it might be different. So yeah, certainly inquire about that, okay? Anything else that I can, you know, answer about people or clarify about stuff I mentioned before? I hope that, you know, oh yeah, sorry, go on.
Oh, well, we got a question via text message
cool.
that
Okay.
I can ask you. So this person wanted to know how many times a day should people, just somebody without any pre-existing conditions or anything, change their mask during the day, and your thoughts on cloth ones that people wear versus the medical disposable ones?
Sure. In terms of the question about changing a mask within the day, I think that's, I mean, if your mask has some sort of damage or gets fluids on it or something of that nature, I think that's a good reason to change it. But I don't necessarily think that you have to be changing it multiple times throughout the day. You know, I think it's probably more important to think about if you do have a reusable mask, which I'll get into in a minute, that you do take some time to clean it on occasion, as opposed to just leaving it in the car all the time kind of thing. In terms of qualities of masks, there are some great articles, particularly from the CDC on this. And so I encourage you to maybe kind of Google something about the nature of like CDC mask quality or something of that nature. Briefly, I mean, number one, obviously the N95 masks are going to be the most superior agent to this one for people who are working directly with COVID infected people. These are considered medical supplies, so we do not have a lot of them right now, so I would not recommend going out and purchasing those. In terms of kind of moving down the line, the kind of regular maybe paper, they're not obviously paper, but they may feel like elements of that. Those are going to be superior to most of the reusable ones that people can get their hands on, as they were designed specifically to prevent the transmission of droplet precautions, of which COVID has that transmission. So that would be the most superior. In terms of the reusable ones, there's a lot of variation between what they're made of and those types of things. I think I do want to highlight of those, the kind of more like buffs or kind of scarves items, because the material in those is not necessarily designed for anything other than fabric. It's not meant to prevent transmission of things. Those tend not to be too great, but they are definitely better than not wearing anything. But in terms of the spectrum, you know, obviously those single medical use medical masks will be the best. Kind of the buffs and things of that nature are kind of on the lowest. And then the spectrum of things in between, you really want to look for items that have multiple cloth items, so polyester, cotton, and then hopefully maybe in a kind of weave pattern that's different. I know some of them have insertable filters in that kind of variety. I can't really comment about that with any certainty because they all have different manufacturing standards and we don't look at all of them from a medical perspective, so I can't really tell you. But with the smoke and everything, it might not be a bad idea to consider the P2.5 filters, if possible, because those are actually meant for preventing kind of the inhalation of poor air quality. So not for COVID, but for poor air quality. So yeah, I hope I attempted to answer that question. So yeah, I do, well, I know it was a text question, so I don't know if there's a response going to come back, but I will address it if one does. I do have another question that says, some studies are showing that increased vitamin D can help against COVID. What are your thoughts about that? I have seen that. The specific article that I read was not necessarily talking about vitamin D supplementation for the general population, but more in the context that people who are deficient in vitamin D can have potential concerns. That's not canon yet. You know, that's not necessarily a recommendation or a discussion from any sort of disease organization at this point. It's still something that we're looking at, and it may not turn out to be anything. You know, again, we are learning about this as it comes. So getting back to the kind of elements of the question though, I don't think that people should be going out and taking excessive amounts of vitamin D, as vitamin D does not clear out the same way in which vitamin B12 or vitamin C does, because it is fat soluble. So it is possible to like have an overdose of vitamin D. So I think it's more about ensuring that you know, our vitamin D levels are appropriate. So that's certainly a discussion to have with your physician about that. So yeah, those are kind of my thoughts. I hope I tried to answer that one. I see you put it in the chat, so please send that to me if you have any follow-ups for that.
Okay, any other questions?
I have one more, sorry.
Okay.
In regards to the preventative care that you're talking about, is there any suggestion about somebody who also weaves in Eastern medicine practices with their preventative care? I know those for me at least, tend to be a little bit more intimate. So it's scary because like an acupuncture or a massage or something like that, if those are weaved into the preventative care maintenance, what are the suggestions with that? Is it something safe to be doing? Is it something, it's a practitioner-based thing? I mean, do you understand kind of the question I'm coming from?
I think I do. So number one, I think the idea that like there's two different types of medicine is not necessarily a great, like it's not a dichotomous thing. They can be weaved together, I think, certainly fine. I think more and more as we learn our style of medicine, I guess in the West, we're incorporating more of those practices. There are certain things, you know, herbal medicines and things like that, that are harmful or may potentially lead to harm. So there are certain things when people talk to me, I do recommend against those things, but kind of getting back to more of the idea of like weaving those things into preventative care life, there's not really strong recommendations that people need to do routine acupuncture or routine massages for things. I mean, that being said, specifically for those items, those do have some evidence for potential benefit in terms of musculoskeletal strains of things of those nature. So I'll talk about those with my patients. You know, in terms of kind of getting back to the supplement or anything of that nature, I think it's just worth a discussion with your doctor. You know, again, we approach things from a level of what have we studied? And so if a study has not really been conducted in any sort of appropriate or large level, and these items may not have a lot of evidence to provide you, but we can certainly have a discussion about how those may play and what things we might want to watch for if people are using those things. So did that kind of address that?
Yes, thank you.
Great. So I do see a follow-up question from another participant, so thank you. The question is, would you recommend micronutrient blood tests to more accurately identify nutrient deficiencies in the interest of optimizing immune function? I swear I'm literate, I'm sorry. In terms of that question, again, I can't really say yes or no. I think the idea is more about there are certain people at risk for having vitamin D deficiency. And I can't go through that entire list because it's not just one or two things, it's several items. And it's not just their risk factors, but based on symptom evaluation and other items. I do think if those things are kind of ticking those boxes, absolutely. And I will do that myself with my patients. I think maybe something I don't know if you were looking at specifically with that question, but something that people will talk to me about is like, hey, I want to get these tests for all of these different things. You know, the point of ordering a test or an evaluation of something is to have a test that is high quality, that when it says it is X, it means it's X and not possibly Y or Z. Now, no test is 100%, but we really shoot for our tests to be very good in terms of their accuracy and specificity for evaluating those items. The difficulty when we start getting into very specific items of blood tests is that, number one, the quality of the tests are not always fantastic because we haven't found a large reason to build a lot of those tests. So there's very few of them, and they do cost quite a bit of money most of the times. And unless there's a specific reason for having that test, it may not be covered by your insurance program, which would imbue the cost upon you. And the finance part of the world is not what I'm aware of most of the time, so I can't really give you much information about that. But just understanding that that may be a consequence of that is important to know.
All right, thank you. Any last questions? This has been very informative. All right, sounds like you have covered it. Thank you so much for your time today. Thank you everyone for your questions. And we will make sure to publish this on our social media channels and good. Additional questions. I was just going to say there might be some more that come up. So we will send those over if we get them. So thank you again for your participation.
Absolutely. Thank you for having me. You know, I'm a member of the Kirkland community and I work nearby. So yeah, it matters to me, and I hope to work with you guys again. So have a good day.
All right. Thanks so much.
Bye.
Bye-bye.
I think I just do that.